Welcome, everybody, to Dental Voice on the Case with Xyrus. My name is Rolando Mia, and today we have a returning guest, another returning guest, and one of my most favorite peoples on the whole planet, Amanda Hill, RDH BSDH. So, first of all, the purpose of Dental Voice is to share with everybody things that you're running into, problems that you're dealing with on a day-to-day basis, and then also how to overcome them. Today's topic is about game changers in dental hygiene and some of these crazy, awesome innovations, and Amanda's going to share that with us today. How are you, Amanda, and welcome.
Well, thank you, Rolando. Always good to be here. I am excited to hang out with you and talk teeth.
Talk teeth. So, today, there's a new innovation. I believe it comes from EMS, and it's Guided Biofilm Therapy. And you had mentioned, or you're kind of the context around that in conjunction with other systems like our system and how that works. Take us through what that's about, and then I'd love to hear about how it works and what's your treatment here.
Absolutely. So I Googled it, Rolando. Guided Biofilm Therapy came out in Switzerland in 1982. So it hasn't been around all that long. So it's pretty new, and it didn't come to the States for quite some time. But what it is that we are using this small particle powder. So we remember air polishing. So we remember sodium bicarbonate, which was kind of stingy when we did it on patients' mouth, and we had to watch their tongue, and it was kind of messy, and we made a big giant mess. But this is huge. Like they walked out and they're like Frosty the Snowman, like all white, right? Totally. So this uses this tiny particle powder, either erythritol or glycine, and you can do it like on the gums and under the gums and even on the tongue, and it actually like feels really good to patients, and it's nice and like gentle and cool. But what it does is it legit disrupts the biofilm on the teeth, under the gums, on the tissues, everything, and is totally a game changer for how we are taking care of patients and how we are removing biofilm. Because we now know, as dental hygienists, we used to just care about calculus, like it was just tartar. That's all we cared about. That's what we were removing. And now we know it's really biofilm that we care about. And so this is a game changer for biofilm.
Cool. So take us through what's going on here.
Okay, so this is my co-hygienist, Erica. She was super sweet to be in the video here. So we are doing guided biofilm therapy. So I have the airflow technology from EMS, and we use an erythritol powder, teeny tiny nanoparticle. And I disclose first. So I'm going old school, back to hygiene school. We do disclosing agent first, which is great because we're actually really getting some good oral hygiene instruction with patients. But here I am using the EMS, and you just kind of make little happy faces back and forth across the tooth. I'm just going little arches, happy faces, happy. And it's really gentle. It doesn't hurt. I just asked her right there. You saw her shake her head. So on 4 and 5, there's some bleeding occurring. And so I wanted to make sure it didn't hurt. And she said, no, not at all. But she's having some inflammation issues right there. And so I'm actually going to put her on a 3-month recall so we can see what's going on there. But we were able to disrupt the biofilm that's happening in that area. And hopefully when I see her in 3 months and I redisclose, that area won't have that inflammation that's going on. But
did the therapy cause that bleeding?
Not at all, no, because you can see in other places, like here I am on number 9, no bleeding at all, right? And I'm doing it, right, kind of up the tooth, and then I angle it into the gum tissue. You'll see it right here, particularly on the next tooth. You'll see that I really get a good angulation to really get up the gum. I switched my hand so it doesn't go up her nose, and I'm able to adjust that right like that, which is really great. But no bleeding there, so there was clearly an issue on 4 and 5. And I really feel like we're going to see some healing when I see her again in 3 months. In fact, I saw my mom. She was one of my first patients because you always try out new technology on your parents, because they're just guinea pigs. And I saw her and used guided biofilm therapy. And then I saw her again 6 months later. And I was like, I disclosed her mouth and I was like, whoa, Mom, what did you do? Like, your mouth looks amazing. She's like, Amanda, I didn't change anything in my home care at all. Like, I'm doing the same stuff. And I've talked to other hygienists that are doing guided biofilm therapy, and they're saying the same things, that really what's happening is we are changing the oral microbiome through guided biofilm therapy and making it healthier. which is a game changer. So now my 6-month appointments or my 3 or my 4-month appointments are faster, which is even better because, oh my gosh, can't we all use more time? So that's a huge game changer for me in health and in time. So here I am. I get a little overspray. I might not be the neatest clinician of all time, but one thing I want to say that I love about this, about using the Isovac with this, is that it's like the Isovac is my dental assistant. And so I get to use my mirror. And so here I am using my mirror for indirect vision. And I use Luminant Ergo Prism loops. I actually have them on right here. They're really fancy. And they are a periscope type loop. So I look straight out. So I get to sit up straight. I look straight out, but I can see straight down. So I can see my patient right here, but I get to sit straight. Ergonomically, it's a dream. And so that's why my head isn't getting in the way of this video. But with the Isovac and with the Ergo Prisms, and then with this EMS technology, it is really saving me ergonomically. This is way less work than getting in there first with a Cavitron and then hand instrumentation and then polishing, all of that, particularly, if I was having to use the high speed, I'd be pulling up my left arm. I'd be doing the chicken wing, which I know I'm not supposed to do, but I'm a chicken wing girl when it comes to ergonomics. So you can see that I do half the mouth with the Isovac in place. And then I really end up doing 3/4 of the mouth. And then I go to the lingual, or I go to the mandibular and do the same thing. And I'll go about 3/4 before I flip the Isovac. That way I only have to place it on one side and then the other side. And I actually will disclose first and then go through with the GBT, and then I'll pick up my Cavitron. But the cool thing is what airflow does is not only is it removing the plaque and the biofilm, but it's also softening the calculus. So when I go back through to use my Cavitron or my piezo or whatever electric scaler, power scaler you have, the calculus is actually easier to remove, which is, again, a time saver. So so I'm able to spend more time, I feel like, with oral hygiene instruction with my patients, and really making sure that, we're getting them to health as opposed to just getting them clean, which I think for a long time was our goal. So I'm about to show one thing that I wanted to make sure that we got on the video. You know how sometimes patients will have on their mandibular incisal edges in the anteriors, they'll have some wear facets. And so there's that, kind of groovy area. And you can't ever clean in that. Like you can't put a Cavitron tip there. You can't put an instrument there. And so I'm able just to use that GBT and just go right on those irregularities and get the biofilm out of there. Because if you haven't disclosed a patient in a really long time, particularly with one of like the two-toned or the tri-plaque gel, so you can see how old the plaque is, it's amazing where the biofilm ends up. And I actually, when all this was over and I was all done, I actually took out everything and I used the GBT on her tongue because her tongue was stained purple as well. So she had over 48-hour-old biofilm on her tongue. So I was able to clean that off with the GBT, totally gentle, didn't hurt, didn't sting like old air polishers used to sting. And I was able to remove that biofilm and really get her to a place of health. And so again, when I see her in 3 months, I think we're going to see a real difference in her health.
That's absolutely amazing. So if I understand correctly, this is used in conjunction with a hand scaler, in conjunction with an ultrasonic. But what's the big difference between this and those? Why would you need all of those?
So what I do this first, and that's really what kind of clears the area. It's sort of, like wiping the table off before I go back in to kind of scrub off little tiny, crusty pieces of food that might have gotten stuck. But for the most part, on a lot of patients, I don't even have to go back and do anything else. I can just use the guided biofilm therapy and they're good to go. It's pretty amazing.
And why doesn't it hurt? You mentioned it doesn't hurt.
So the particle size is so tiny. So within the sodium bicarbonate that we're used to, the salty stuff, that was 40 microns. And then the erythritol is all the way down to 15 microns, which I know probably doesn't mean much, but I got to tell you, if you use it in your mouth, it just feels like a gentle spray mist. Like it doesn't sting because that particle is just so tiny. It's not sharp.
That is amazing. So I have a million questions. First one, so in dental hygiene, there's a method, there's an approach that people have. How difficult is it to adapt or adopt or add this? Doesn't it kind of mess up your kind of your rhythm and your flow?
So I did change my flow, like I said. So I used to do surfaces towards and then surfaces away. You know, I turn myself and turn myself. So I did learn, because of the using the Isovac and not wanting to flip flop it, to go kind of 3/4 of the way across and then 3/4 of the way across and then flip. But, you know, I would say it took a day, and I was involved in, I was, you know, totally on board. The one cool thing, if you've never used an Isovac before, the cool thing is you can see her tongue is behind that mouthpiece.
Right.
And like during the procedure, she can move her tongue around and kind of push the water into the suction device. And for that chatty patient, because we all have that chatty patient that interrupts you all the time. They're like, oh, wait, hang on. I gotta sit up and spit. And they add like 20 minutes to the appointment. You put this thing in and you just get to do your job. So GBT saves time. It says the studies show that it saves 7 minutes an appointment. And then I think that Isovac saves time too, and saves my body, which is great. It's like like I said, it's like my little dental assistant. That's, you know, because as a hygienist, I'm never going to get my own darn dental assistant. So it gets to act like my dental assistant, so I can do my job and control aerosols and keep the patient comfortable and be able to use this technology. It's funny, when I showed up at my office, when I first was hired, they already had this technology in place. And I was so excited. I was like, oh my gosh, you guys have GBT? And they're like, yeah, we don't use it. We don't like it. I was like, what?
Why?
Why? No, this is like revolutionary. I'd seen a course at Under One Roof in 2018. Like, I was psyched, right? And she's like, well, it gets in my face and it's too many aerosols and I don't like it. And so after some more questioning, I figured out she was just using a saliva ejector, you know, hanging out of the patient's mouth like this. So just slow through each suction. And then she's trying to spray these aerosols everywhere. So once we brought in some high-speed suction, boom, game changer. And it's funny, we only had one unit, and within 3 months, we had to buy a second unit because the patients only wanted guided biofilm therapy from now on. They're like, no, I want to go in the room that has that. I don't want the other room. Or they'd tell their spouse about it. And if their spouse ended up in the other chair, they're like, no, I want that thing that my husband had because that was really great. So we had to buy a second unit right away.
So, oh my goodness, what a phenomenal story. I love the context around they already had it and then now they're using it. How hard is it to adapt? And you know, you mentioned this whole context. It sounds like in addition to getting rid of debris, it also, well, what makes it really unique is it gets rid of biofilm. Is that what I'm hearing?
Yeah, it blasts through that biofilm. And it's not like, you know, when we think about like ultrasonic, sure, yes, we are disrupting the biofilm, which is why we use an ultrasonic scaler, right? But the ultrasonic scaler, it only disrupts the biofilm exactly where it touches. And we know that the only active part of that tip is like the bottom 2-3 millimeters of that tip. It is tiny, tiny. And you have to go back and forth, back and forth, back and forth, back and forth. And so, you know, like if you try to color in with the tip of a pencil, you know you're going to get spots that you're not going to get. So when you're using this, air polisher, it shoots out and it's able to really get across a larger surface. If you think about using a pressure washer, like on your sidewalk, right? And, you know, you use that, oh my gosh, it's so satisfying. I'm sure you've like written your name in it before or whatever, and it just like totally cleans the nooks and crannies of the sidewalk. Or if you had done that with a scrub brush, it wouldn't be as clean. And so this is sort of that same kind of concept that you're really breaking through the biofilm on a larger scale. And you can go beneath the gums. Ours even comes with a perio tip. So regularly, this tip goes 4 to 5 millimeters deep. And then we have a perio tip we can put on, and we can get up to 10 millimeters deep. And hygienists, I know, have taken 10 millimeter pockets and gotten them to go to like 6s or 4s. And where we haven't gotten bone regrowth, we are getting attachment. And attachment is key for biofilm to not regrow. So, and oh my gosh, this is safe on implants. Let me tell you, I'm kind of afraid of implants. I will admit to you, I'm sure somebody's going to ping me for that, but it's just confusing. Plastic instruments, what do I do? Floss, no floss. The rules are so hard. This will not hurt an implant, and it will remove the biofilm.
So if I were to ask you to summarize the top 3 things to take away from this for our viewers, what would those be? I
would say that to me, this is game-changing technology for 3 reasons. For biofilm removal, because that's what we know, right? We know that biofilm is the key for our patients. It's a game changer for me as a clinician, for my body. I'm able to sit up straight. It's way less hand fatigue. It's really easy to use. And then I would say that it's great for saving time. It's amazing. The amount of time that I'm able to cut back and spend more time on oral hygiene instruction and really help a patient come to understand and own their condition.
So it's a conjunction of the multiple technologies to do all
Yes.
that. There you go. So if people wanted to know more information about obviously the Isolite, they can come to us, but what about this guided biofilm therapy? Where can they go?
Oh, well, if you have some questions, feel free to reach out to me, amandahillrdh@gmail.com or amandahillrdh.com, or you can go straight to EMS. There are other companies out there that make them. This is just the technology that is in my office and I'm familiar with. But yeah, and there's lots of great courses out there to learn more about this technology. Truly, this should become our standard of care.
Awesome. Well, first of all, thank you so much for joining us. Thank you for sharing that. I learned a lot. I learned a whole lot. The whole context about biofilm. It's funny, you think about the debris, you don't think about the biofilm. So thank you for sharing that with us. Oh my goodness. Those of you who like this, please share it. If you have questions for Amanda Hill, please reach out to her. She is probably one of the most engaging people. She's got this incredible talent of taking really complex stuff and then communicating in a way that's easily digestible. And it's something that I very much appreciate. And I learn every time. And here's
We're always learning.
At some point, would you like to join us back again? I don't know, sometime in the future.
You can't keep me away, bro. You can't keep me away.
Well, thank you so much for joining us. Have a wonderful rest of your week. Please say hi to our friends that you're going to be heading out to RDH Under One Roof here.
Under One Roof in the morning.
Exciting in Indianapolis. So I think that's fantastic. It's great that we get back together. So thank you for joining us. And it's always a pleasure. And yeah, this is awesome.
Good to see you, bro.
Okay, take care.